Welcome back, or if this is your first time here, welcome. This is Health 101. The slide is to suggest that we should know what we don't know. And when I graduated from med school, I thought I knew everything. And it wasn't until about 40 years after I'd been in practice that I realized I didn't know everything. What I realized was that, yes, I could diagnose and I could treat, and that's very important. But what I didn't know, and had never been taught in med school, and had recently learned about this by just reading myself and exploring, what I learned was we need to know how to prevent. That is so much more important. It's much less expensive, less painful, and if we can help our patients do that, then I'd be happy. And that's what these talks are going to be about. The talk today is going to be about cancer. Cancer is the second leading cause of death. Smokers represent the largest subgroup, and breast cancer is next. Once you're told you have cancer, your life is forever changed after. 80% of cancers result from things that we know cause cancer and could prevent. Tobacco's been known to cause cancer more than 50 years, and yet close to 500,000 smokers or tobacco users die every year having used tobacco. Malnutrition globally is becoming the second leading cause of death, replacing cancer, not because there's less cancer, but because there's a lot more malnutrition. This is a why not try this? It's very simple. If you just eat 15 mushrooms a month and drink 1 cup a day of green tea, you can reduce your risk for breast cancer 90%. And I'll spend much time talking about breast cancer because it's a leading cause of death, and there's some good news that I'll be bringing to you about it also. But most men who have prostate cancer, and most men do after, say, age 60, most people die with it rather than from it, and never even knew they had it oftentimes. Colon cancer is helped by early diagnosis, and I wasn't going to spend much time talking about early diagnosis. However, I have listed under books and video recommendations some work that Dr. Gilbert Welch has done. I would highly recommend becoming familiar with the work that Dr. Welch has done. Watch some of the videos that I've mentioned in my recommendations. All things considered, most cancers could be prevented by our lifestyles and our nutrition. So if you smoke, quit. And I used to be a smoker. I smoked for 35 years and then realized one day that I didn't need to continue, and I just went out and bought a carton. So I wasn't going to quit on the basis of not having them. I was just going to quit because it wasn't a good thing to do. With nutrition, the thing that got me really interested was watching a video which is available on Netflix as an instant play called Forks Over Knives. And today, and I talked about this in a previous talk, the president of the American College of Cardiology is a vegan and recommends that that be the diet that everybody has to prevent heart disease. And if you eat a plant-based diet and quit smoking, you'll probably not get cancer. The odds are you won't. It doesn't guarantee that you can't, but you're going to improve the odds considerably. Now, cancer isn't just one thing. Cancers behave differently, and what one person gets may not be what happens exactly to the next person that gets the same cancer. So there's several kinds of cancers: breast, lung, colon, prostate, ovary, cervix, and cancers are named after the organs that they originate from. Well, here's a slide about breast cancer, and what it's showing is that on the left side you can see age-adjusted death rate per 100,000, and at the bottom you're going to see dietary fat intake. And it seems as though there's quite a relationship between the amount of fat you eat and whether or not you get breast cancer. If you look at the green arrow down here, you can see that Ceylon, El Salvador, and Thailand rarely have people dying from breast cancer. If you look up at the blue arrow, you're going to see the US, and you're going to notice the intake of fat is high and the death rate is high. And that's just the reality of it. If you want to try to avoid these things, then decrease the amount of fat in your diet. According to Dr. Welch, there are different kinds of cancers. And I've listed them here on this slide. There are birds that grow very, very fast in nature, and as well as cancers that grow very, very fast. Then he says there are some that grow slower, and he's called those rabbits. And then there are some that grow even slower, and he calls those turtles. And there are some that just don't really take off much, don't grow, and they're like the dodo birds. They become extinct. They just disappear. And what you can see on this slide is that depending on the kind of cancer that it is, the ones that grow really fast cause symptoms, and when they reach a certain size, they cause death. And that's true of the bird-like cancers and the rabbit cancers. But when we get to turtles, they don't necessarily cause symptoms, and they don't cause death. They're like the prostate cancers for men, oftentimes. But there can be different kinds of prostate cancers, and I wasn't really going to be talking specifically about that. And then there are the dodo bird cancers, and they're the ones that you get that you never even knew you had. And so when it comes to those kinds of cancers, would you want to know if you had a bird cancer or a dodo cancer? One you really couldn't do much about, and one that would never be an issue. Once you get labeled with cancer, you're changed forever. The good news is that there has been some progress made with regard to breast cancer. Really depends on the type that you have. If you have an estrogen positive breast cancer, they've really been able to reduce death rates. And that's wonderful. And what you can see here is that from 1975 to 2010, the death rate was decreased 30%. I'd highly recommend looking then at Dr. Welch's video that's on the last slide. And he's talking about overdiagnosed. I mean, if you get one of those dodo bird cancers, would you even want to know about it? I can only speak for myself, and everybody's different. But the wonderful news is that progress is being made with treating breast cancer. And it used to be that, women were told, if you don't get a mammogram, you're crazy. And that's what the American Cancer Society ad suggests. But the reality is that the better treatment gets, the less screening is effective. So what this shows is that the better treatment gets, the less you're going to have effective screening. Now, Dr. Barnard, in one of his YouTube talks, said that switching from a standard American diet to a plant-based diet would be the equivalent of quitting smoking. But I think you don't want to be that narrow about it. Why not do both? Why not quit smoking and switch to a plant-based diet? You get a lot more for your effort, I think. The American Cancer Society has now suggested way back in February of 2015 that if you switch to a plant-based diet high in fruits and vegetables and unrefined grains, while at the same time eating less red meat and processed meats, refined grains, and sugars, that these diets are contrasted to Western diets, which have the opposite pattern and are heavy in meats, sweets, and processed foods and dietary fats. And if you do switch, then you're going to decrease the likelihood of developing cancer. Other medical organizations have suggested that their doctors recommend plant-based diets to their patients, and we're probably going to see this more and more. Dr. Williams, who was the president of the American College of Cardiology, was being interviewed, and during the interview he was saying that it's not just the red meat, but fish and chicken, even skinless chicken, have a lot of fat in them. Dairy and eggs promote cancer. So I think when you become a vegan, you eliminate all of those things and you decrease the likelihood you'll develop cancer. Well, if you do switch to a vegan diet, and I've shown on the left part of this slide what it consists of, and it consists of vegetables, legumes, which are beans and peas and things of that sort, grains and nuts, and especially fruits. The number of people who eat this way constitutes about 3% of the public, according to many studies that have been done. And that's why we have more than half the population with chronic disease. And then most of these things you can do at home. You can get some help about how to prepare it from any number of books and talks online. But I think the main thing is just sticking to the vegetables, the legumes, the greens and nuts, and the fruits. And when you do that, you're going to lose weight. If you're diabetic, that's going to be very helpful. If you're on the diet that enabled you to get cancer in the first place, and you stay on that diet, that's not going to be all that helpful. That would be like the cigarette smoker who gets lung cancer continuing to smoke after he's been diagnosed. And when they quit, and they've done studies on this, they find that they live twice as long after as they would have. Overdiagnosed is a really interesting book, and I'd highly recommend it. Should I be tested for cancer? It's in the same category. I used to teach medical students and residents in training, and I found this book, and I was so impressed that I got copies for them. And then How Not to Die is also very good. I would point out that Dr. Greger has a website. You can subscribe free, and every day, Monday through Friday, get a 5 to 10 minute video or article about nutrition. He's highly regarded as one of the experts. And Less Medicine, More Health is also by Dr. Welch. Well worth reading. It talks about the assumptions that we make about our health and what to do about it. And he talks about 7 that are really perhaps not accurate and correct. Then the videos are all on YouTube, and I'd recommend them all. Well, that's it for Health 101 talks. If there are other health topics you're interested in, send me an email and let me know, and I'll try to do some more talks about that if there's an interest. And then I'll do one more, Health 101, that's just going to be a summary of everything I talked about in the 6. It'll be, I don't know how long altogether, but it'll be a rather short synopsis of each thing. Thanks for your attention.